and today I've been asked to present about the strategies related to national program, and that's beyond um, uh, COVID 2019. So I'll be sharing some of my the guidelines which have been presented given by the government of India, and some of my views related to this thing. And let me be very clear, the data which we will be presenting that may change with time, and you can see the daily data is changing. So you have to refer to your country local authorities for the latest data and policies and guidelines. As you can see, today we have crossed 80,000 COVID-19 cases in our country. Probably I remember around 20th of March when we start tracking this thing day by day. There are only 250 cases, and the government of India started lockdown. So that since then, probably most of us are feeling panicky. What will happen to us? And when we talk about our hospital, especially our institute AIIMS, Apex Healthcare Institute in the country, probably it has turned into most of the corona cases. Most of the routine services have been stopped. Eye care services, routine OPD, routine surgeries are not there. Only emergencies are being permitted. And at this stage, at this point, after 50 days of lockdown, and we are more than 80,000 cases now, probably the initiative which have been taken by Orbis so that we can think of like normalizing our services, how we can adopt to the routine channel. That is something a very good initiative, and I'll try that I'll be able to help the country in a way that we can try and come back to the routine system. As far as the national program is concerned, uh, 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 India was the first country to start the national program for control of blindness way back in 1976. And it is basically program where it's monitor the program, it evaluate the policies, it's a provide budget to various segment of people. It is a guide and support also. And people are looking forward to national program, like what are the guidelines that can be like provided by the programs for actually uh, for the services that can be seen as a routine process can be evolved. The goal of the national program of control of blindness is to achieve to a level of blindness of less than 0.3% by the year 2000, and which was revised to 2020. And in fact, as per the national health policy, by 2025, we are keeping up aim that it will reduce to 0.25%. Whereas if we take the global strategy, the WHO adopted Universal Eye Health as a global action plan, and that was in 2014. And the goal of that plan was that we should be able to reduce the prevalence of avoidable blindness, avoidable visual impairment by 25% by the year 2019, taking a baseline as 2010. So this is another initiative. The national program was initially talking about the blindness, where WHO said we should look for visual impairment. If we see the trends of blindness in our country, when program was started at that time, the prevalence of blindness was 1.38%. Though our goal was to achieve to 0.3%, but even 2007, we reached to a level of 1% of blindness. But the difference was here, the definition of blindness was presenting visual acuity less than 6 by 60 instead of less than 3 by 60. And at that time, the NPCB showed that there are around 12 million blind people in India. Whereas we recently conducted a national blindness survey, and as I mentioned, there are two different targets related to blindness prevalence and related to visual impairment. WHO gave figures about the visual impairment in India as 5.3% and blindness as 0.6%. The national survey, which was probably one of the largest survey conducted in 31 districts all over the country and covered 93,000 people, and that showed the prevalence of blindness has reduced to 0.36%, nearly 47.3% reduction in blindness. And prevalence of visual impairment is 2.55%, nearly 51.9% reduction against the target of 25% reduction. If we see the causes of blindness and visual impairment, so this is very clear. The cataract is still the major cause. In the previous survey finding, it was responsible in 2001. It was responsible for nearly 62% of blindness, and currently it is 66% of blindness. The second important cause which has emerged is basically the corneal opacity, which is non-trochomatous corneal opacity, responsible for nearly 7.4% blindness. The another important thing is the cataract surgical complications is now nearly 7.2% of the blindness is due to complications. So you can understand our main emphasis is towards cataract and cataract surgical complications and corneal blindness. The another finding in the survey was that refractive error is no more important cause of blindness, though it is important cause of visual impairment, but definitely not for blindness. And also the diabetic retinopathy, it is a huge burden, but as far as blindness due to DR is concerned, it is just 1.2%. So still the government of India, the plan that we should, as part of Vision 2020 program and NPCV program, these important, the cataract, the most important one, refractive error and low vision, corneal blindness, including trachoma, then childhood blindness, glaucoma, and diabetic retinopathy. If I had to need to summarize the key activities of the National Program for Control of Blindness and Visual Impairment in India, the first is the free cataract surgeries available to the people in the country. Second is the school vision screening program for refractive error, especially for myopia, where free spectacles are distributed to school children. Third is for corneal blindness, is the corneal blindness, the collection of the donated eye and free keratoplasty surgeries. Then diagnosis and treatment for DR, squint, glaucoma, low vision, childhood blindness, and ROP. Then infrastructure upgradation in terms of vision centers, eye banks, operation theaters, and wards. Training of eye surgeons and paramedical ophthalmic assistant. Information, education, and communications for prevention and promotion of eye health. And also monitoring of the program through workshops and training programs and all those things. One thing which I would like to mention is like WHO want that trachoma should be eliminated by 2020. And under zero reason, probably India and Myanmar, they are the only two countries which have not yet declared trachoma elimination. Probably what we need is to show that trachoma is eliminated, and for this, nearly a survey is required in 200 districts, and Government of India is planning to do survey in recent future. And I believe even after this COVID pandemic, this may be feasible, and we'll try our best that should be able to declare that India is trachoma free. Some achievement of the National Program for Control of Blindness. I'm just talking about what were the achievement this year and of the target current year. The cataract surgery is probably the most important part of the national program. And you can see against a target of 67 lakh surgeries, the previous year we got 66.9 lakh surgeries. That's something we are achieving target for cataract surgeries. And we have to see whether it is feasible even after this COVID pandemic or not. For other disease like DR, glaucoma, ROP, and pediatric surgeries and keratoplasty and VR surgeries, probably you can see against a target of 6 lakhs, we have covered 6.14 lakhs. Like it is much more the targets, and this achievement is significant because in previous years this number was much less. Spectacle for school children, the target caps are 10 lakhs, and in fact what we have achieved last year is 8.82 lakhs. It's nearby around 88% of target have been achieved. And as far as cornea, the collection of donated eye is concerned, it is 68,409, and the targets are 70,000 for 2019-20. I have discussed with Dr. Promila Gupta, DDG, and she said the target for the next year were capped as nearly 10%, are being capped nearly 10% more than the current targets. But we have to plan to achieve strategies. In fact, this is a lecture where we can think some of the methods, like in spite of COVID-19, how we should be able to achieve this thing. What government is providing funds through NPCBs for cataract surgeries, it is 2,000 rupees. Even for other surgeries, it is 2,000. That is for DR, childhood blindness, glaucoma, surgery or laser. Then for keratoplasty, it is 7,500. It is for cataract surgeries, it is for DR, childhood blindness, school children for presbyopic glasses, both they're providing 350 rupees per spectacles. And for cornea collection, if it is 2,000 in eye banks, and 1,000 rupees for eye donation centers. So these are the things which are there. But when we talk about COVID, the government of India recently, they have come out with some guidelines for functions, and these guidelines, they are like brought recently on 8th of May only. I'll be covering these guidelines so that each and every person should be aware that what government of India is planning at this stage. One thing is very clear, that all eye care facilities, they are now open to carry out routine clinical activities, including OPDs, IPDs, and surgical procedures in all areas except in the containment areas in red zone. So this is something of very good news. In fact, there was some confusion. The DPMs, SPOs are not aware. Let me tell you, the government of India has sent instructions to all the state program officers about these guidelines, and probably now each and every NGO, they are free to start surgical procedures and OPDs in their areas. But they have to take care of all the precautions related to social distancing, wearing of mask, face shield and goggles as per the guidelines, frequent washing of hands, hand rubs. The special guidelines are also available for all these things. And yesterday, Dr. Umang Mathur very clearly mentioned all these things in his lecture about the system changes. And it is being advised that there should be a minimum time should be given to patient in the premises, and the guidelines related to social distancing norm, that is minimum 1 to 2 meter distance, minimum 1 meters, ideally 2 meters, and between 1 to 2 meters is should be there in between patients. And it is expected that all the institutes, all the state, they will provide guidelines, SOPs related to these guidelines to their hospitals, and they should be strictly enforced. This is also advised that the agency should ensure minimum touch of their OPD cards, trial frames, trial lenses, and other paraphernalia being used in IOPDs, and their frequent disinfections. This they have to ensure so that the COVID infection should remain minimal as much as possible. It should not spread to other people. The patient should wear, not only the healthcare professional, the patient should wear the face covering, and they use hand rubs before entering the OPDs. And only patients who do not have symptoms, they should be allowed to enter OPC. For that, specific questionnaire are there, and specific performers are there, consent forms are there for the patient. And this is very essentially required because they need to disclaim the responsibilities from development of future corona infections in the patient. The legal aspects into this thing. It is expected that all the agencies, they should take proper consent, and consent forms have been given by the All India Ophthalmic Society, and these are special set of questions are there, which was covered yesterday. These need to be asked for it from each and every patient who's attending OPD and also the surgical services. But one thing is, Government of India is very clear that outreach camps are not allowed at this stage, because the reason is very clear. This may lead to overcrowding. So the guidelines related to social distancing may not be maintained. So outreach camps at this point, they are being deferred probably for at least next 2 months. But we are waiting for the next guidelines. Let's see, it will 2 months, 3 months, or 6 months. And also mobile van also, because it was expected when we are sending mobile vans, again, the people they collect, and this again, social distancing measures are not being taken care of. That's why the government want that even at this stage, mobile van should not be sent in the field. But they are very clear that it's time for tele-ophthalmology and teleconsultation. Telemedicine guidelines are already being given by Government of India. It is expected that people should explore opportunities for tele-ophthalmology and teleconsultations, and especially in the difficult areas. And for IEC messages, health education, etc., it was suggested to use digital means, the telehealth means, instead of collecting people at common place. For banking, the Government of India is very clear that eyeball retrieval is not permitted from homes at this stage. However, the hospital cornea retrieval program, it can be continued in non-COVID-19 patients, dead patients, and it should be mainly used for therapeutic purposes instead of optical purposes. Beside this, during surgical procedures, the surgeons and the OT teams, they should follow the guidelines and precautions. There are no separate guidelines for cataract surgeries or other surgeries. They said that the government of India given general guidelines they should need to follow it. But one thing is very clear that pre-surgical COVID-19 test on patient is not mandatory. It depends on the institute themselves. If they are interested, they can go for this test. But as per the official NPCB guidelines, this pre-surgical COVID test is not mandatory. And this is something very positive. This has happened. Actually, all the institutes, especially in Gangaram Institute, I could see the guidelines that pre-COVID test is necessary before every admission, and that was creating a lot of panic among the healthcare providers. So ultimately, now the government is very clear: such test is not required before surgery. This is a slide which is probably looks very like heavy slide related to PPEs. These guidelines are given by Government of India. In fact, they're huge guidelines. I am summarizing these in one slide, and the most important point is that this is related to the ophthalmic OPDs and ICUs and critical care and lab. Here in ophthalmic OPDs, they are probably coming in this moderate risk zone. And when it is moderate risk, what is expected that use N95 mask if some aerosol generation procedure is being used, goggles, and then face shield is to be used when some fluid is expected, and latex examination glove. These four things have been recommended as per the guidelines. But in case it is other services like help desk, registration counters, or even the pharmacy, ward, general emergency lab, radio diagnosis, or blood bank, all these things have been considered as mild risk. And what you need is just two things: the triple layer medical mask and latex examination gloves, mask and gloves. Here you don't need N95 mask. Probably only the emergency areas where patient with acute respiratory illness are there, they are taken as high risk, and there you need full complement of PPEs. So what I want to say is that as far as eye care is concerned, probably you don't need full complement of PPEs as per Government of India guidelines. But what you need at maximum is the N95 mask, goggles, face shield, and latex examination gloves. What we are finding is many agencies, many like people who are preparing equipment for eye care, they are already providing equipment with this face shield. That this is being now started. And when we talk about the supportive staff, administrative in financial engineering, they just need face cover. They don't even need triple layer mask or latex something. So probably looks odd, but it's very simple. That moderate risk, it is basically you need all these gadgets, and when it is mild risk, it's only the triple layer medical mask and latex examination gloves. But Government of India is also very clear that all the standard precautions to be followed at all times, and PPs are not the alternative to basic preventing public health measures such as that maintaining distances or respiratory etiquettes, which must be followed all the times, and also the laid down protocol for disposing of PPs. These guidelines are there. It is suggested that gloves should be thrown into the red bins, and the rest of the things like masks, etc., they should be in the yellow bins. In additions, it is expected that patient and attendants, they all must wear face cover. Beside this, government, if any COVID-19 patient is detected in your facility, there are certain guidelines for that also, and it is expected all the healthcare staff, they are involved, they are in contact patient, they should obey those guidelines. And here, this is actually something very panicky for our eye care providers, because if they are having a fear, any such patient is been identified who is found positive, probably they have to close they shut down their services or something. And it is suggested, in fact, Dr. Umang Mathur suggested these things very well yesterday, that you can keep two or three different teams in your institutes, and they will be working at one time. But here problem is that when we have only one ophthalmologist or one team only, then probably you need to take all the precautions related to these PPEs, and and it is really difficult and panicky for all of us. Arogya Setu app, probably most of us are available, that all of us, all healthcare staff, in fact, everyone, they must have this Arogya Setu COVID-19 tracking app in their mobile phones with the location enabled. And in fact, this is very useful. Even I am using it. It gives so many things. It gives health education about COVID, statistics COVID. The most important thing is if any COVID patient is around, it gives that these mass of patients, this number of people, they have shown symptoms positive for related to COVID, or they're high risk, and even these are the COVID cases. And I expect that all of us should use this Arogya Setu app in our mobile phones. There are some guidelines have been developed by All India Ophthalmic Society, and I'm very happy with how the team from the nearly more than 200 people, they have worked together. There are huge guidelines in 16 different chapters, and covering almost everything related to clinical aspect of eye care. In fact, there is a committee related to guidelines for community eye health programs, and in fact, we have develop consensus among Vision 2020 groups, National Program for Control Blindness, and various community ophthalmology experts from RP centers and from major NGOs. So I'll be summarizing some aspect related to these guidelines in relation to community eye care programs. And these guidelines have been developed based on different zones, whether it is green zones. It is very clear when there are no confirmed cases for 21 days, it is taken as green zones. Red zones, when there are high doubling rates in any area, it is red zones, and orange is in between. And Government of India has specified containment zones in the red zone districts. They are the basically hotspots where actual cases have been identified, and the contacts have been seen. Probably these are the areas where very risky, and we need to be very careful while working in these areas. This is one slide which was prepared after a lot of discussion, and I think can be useful what services can be started in different area, different zones. As far as primary eye care centers or vision centers are concerned, everyone is very clear that vision centers should be started immediately in all the zones, in green zones, orange zones, red zones, except in the containment zones, which are very small areas in some districts. The transport facility for camp patients, they are advisable in green zones. In orange and red zones, because they're the lockdown areas, these facilities are still not been permitted, but definitely in green zones, they can be started. Mobile vans, some of us were very keen that these should be allowed in green zones, but many experts, they wanted that even we should avoid it, because when we have mobile van clinics, the chances of this social distancing measures will be difficult to maintain. So at this stage, it was decided we should not advise mobile vans, and even the Government of India has come out with the same guidelines. So mobile vans are not being permitted at this stage, but we are hoping that very soon these will be allowed. As far as the comprehensive eye camps are concerned, where most of the NGO hospitals, they were conducting camps in remote and underserved areas, but the government and the group is very clear about these things, that these camps should not be advised. When we discuss about how long should it take, so some people were clear that at least 2 months. And of course, we are hoping that COVID the number will come down. But if it is not, then we may have to wait for this for around 6 months also. It all depends upon the number of COVID cases, whether the curve is getting flattened or not. As far as the refraction facilities are concerned, except in the containment zones, it was advised that we should start refraction services in all, even in red zones. Reach and cataract surgeries, even the government guidelines are saying that should be allowed, except in the containment zone, should be permitted. And the tele-ophthalmology, now this thing is very clear. Other things are not available in containment, but tele-ophthalmology, teleconsultancy is definitely advisable even in containment zones. For cataract surgeries, in fact, this is one area where government has not yet given any special guidelines. And they said if camps are not there, patient for surgeries can be admitted from the vision centers, And of course, the government only will be happy to provide refund for these surgeries as per the NPCB guidelines. Only camps are not required. A patient admitted through vision centers can also be given reimbursement. Of course, the AOS guidelines are very clear about cataract surgeries, what precautions to be taken. I suggest that all of you must read those guidelines so that then you should be able to start these services in your hospital. And in fact, this is probably the most important aspect. Like India, we were looking that India should be cataract blindness backlog free country. Cataract is still the major cause of blindness, and the major problem in relation to cataract is the current situation, the COVID. One area is the demand for cataract surgery. We can easily see that demand is reduced. You can see that patients are usually old age patients. More than 60% cataract surgeries are being conducted in 60 plus age group. And that is the risk group for COVID. Patient, they have fear. They might not come for the surgery. And this is a major fear actually. And what we need to generate demand for this. Probably the best way is to use the healthcare volunteers in the country. They should screen patient by house to house screening, and they should even create awareness about COVID as well as awareness about these patients, that all the precautions are being taken for surgeries and the chances of spreads are almost negligible or minimal. Then this is probably the only way at this stage, that creating awareness, counseling, guidance of people so that they should come to hospital for cataract surgeries. The another important issue is that feasibility of high volume cataract surgeries. At this stage, because of the PPEs issues, corona issues, one thing is very clear. The institute which were having a model of high volume cataract surgeries, it will be very difficult for them, because it is advised that we should wait for nearly 10 to 15 minutes, maybe up to 20 minutes after every surgeries. Only one table should be there. So all those guidelines are there, and we assume that the number will be reduced significantly. What we need is that more and more service providers need for more secondary level eye hospital in the country. Though we have a huge number of secondary level hospitals, but still it is expected that there should be some norms. At present, we say that there should be one secondary level hospital per 5 lakh population. But what we are expecting that this norm should relax and we should have more number of secondary level hospitals, so that the cataract surgical facility should be available near to the patient, especially in the underserved rural areas. And of course, there is need to work towards, if we are looking for these services, infrastructure, equipment, human resource, and the cataract surgical service. So all these things, at this stage, probably we're doing very less number of surgery, but in due course of time, more such centers may be required. Quality is an important issue that will always remain, but the most important issue is the sustainability for cataract surgeries. And I believe each and every institute at this stage is thinking how to get the cost for cataract surgeries. I have a very strong doubt whether NPCB will be able to, or EBCS will be helped in this regard, because probably most of the budget will go into other sectors at this stage to strengthen the economy of the country. And even in healthcare, probably it's more into COVID areas. Eye care may not be that much important at this stage. So getting fund through NPCB may be difficult. And the only option, the best possible option, which I feel is the Ayushman Bharat, that all the surgeries, cataract surgeries, which we are doing at this stage or will be doing, should be part of the Ayushman Bharat. In fact, last year, there are a lot of issues. Some of the states, they have stopped cataract as part of the Ayushman Bharat scheme. In fact, my suggestion, my request, Government of India, that it should remain in all the state. Cataract should be part of it. And in fact, what we are expecting, that cataract and other packages should be reconsidered and more amount should be given for these surgeries to NGOs. This is the best possible solution for us. And it is requested from Vision 2020, from Government of India, NPCB, that all of us try our level best to go for advocacy into this area, that cataract and other procedures should remain as part of Ayushman Bharat in our country. The another important area is the strengthening primary eye care. In fact, in last few lectures, whether it is Dr. Umang, Dr. Tulsi, even Dr. GVS Murthy, they promoted this thing that we need to go more close to the people. And when we talk about primary eye care, it is basically three different components are there. One is the vision center, which we are expecting that one vision center should be there for every 50,000 population. Then health and wellness centers, which were expected should be there for every 5,000 population. Vision center is being managed by paramedical ophthalmic assistant, and health and wellness centers. Basically, it is the ANM, multi-level health workers, and one person, one medical officer or nurse were also there in the health and wellness centers as per the Ayushman Bharat scheme. And the third group is basically at the community level. It is the ASHA workers and Anganwadi workers and school teachers. They're working for every 1,000 population. You can easily see the health structure in our country. In 2004, when Vision 2020 Right to Sight was adopted, at that time, what we were thinking that we'll have nearly 20,000 vision centers in our country. And even at this stage, what we are saying that there are hardly 4,000 vision centers. So it is very clear. It is the right time, and it is opportunity for us to strengthen our primary eye care services, especially the vision centers in our country. And it should be at least 20,000 vision centers are required. And vision centers can be both the type. It can be integrated vision center, which is with the primary healthcare system, which is basically Government of India strategy, and also the standalone vision centers, primary eye care, where most of the NGOs, they develop primary eye care, and both are valid. Probably what we need is more and more such centers in our country. The activities which can be performed in the vision center immediately at this stage are basically early detection and treatment of cases, and first line management of all the emergency cases and their referral. Vision testing and refraction is very much possible and can be allowed with all the precautions. Dispensing of spectacles, it is feasible, should be started immediately by most of the centers. Then refer and triage of individuals who need surgery. The triage is very important, that we should not refer patient with fever, cough, etc. to hospitals. So that is extremely important. And post-operative follow-up. And the last component, which I personally feel is very important, is basically you need to develop the primary eye care volunteers, whether ASHA or other volunteers, with the help of telehealth training. It's the right time that we need to train these people. As I mentioned, Health and Wellness Center, it is probably one of the major initiative of Government of India right now. They are planning to develop 150,000 health and wellness centers in our country by the year 2022. Already in March 2019, there are 29,414 centers were there, and they are actually developing with the right pace. And as far as eye care is concerned, there was a committee which was developed, and that task force, they already submitted their recommendations, and probably there very soon these guidelines will be there at the portal also. And what we recommended, that most of the primary eye care activities should be initiated at sub center or these health and wellness centers. Health and wellness centers, they work above the ASHA workers for 5,000 populations, and nearly 5 ASHA workers work under each in centers, and many activities can be started under health and wellness centers. For ASHA workers, probably we are very clear. Already we have more than 1 million ASHA workers in our country, and it is necessary that ASHA workers should be trained in eye cares. They should be involved in eye health education and awareness programs. They should be able to identify blind and visually impaired cases, and even patients with common ocular mobilities. And the most important thing they can do is they can timely refer the patients to all our vision centers and hospitals. In fact, we have a very good initiative taken in RP center, and what we realize that ASHA workers, they definitely need training. A one-day training is sufficient for ASHA workers as far as basic primary eye care is concerned. The key issues with ASHA workers is they are very poor in record. If you expect they will maintain record, it is very, very difficult. They are not good in taking vision of blind or visually impaired. They find difficulty, space issues, there are social issues also there. And also they are not very much ready in coming patient to hospital to coming with the patient to hospital for cataract surgeries. But as far as the other activities are concerned, probably awareness generation, vitamin A prophylaxis, mobilizing patient from vision center to the vision centers for referral services. Asha workers, they work excellent. The only thing what we need is that we need to provide them good incentives. And in Delhi government, they have taken such initiative. The incentives are being provided separately beside the National Health Program. Probably I request that most of the SPOs, they now take this initiative to involve Asha workers into eye care, fix some incentives, especially related to cataract and for refractive errors and diabetic retinopathy for these ASHA workers. And, and it is the right time that such they should be promoted and they should be involved into eye care. Some of the NGOs, they find difficulties in working with ASHA, that ASHA is being not allowed working with the NGOs. Probably there are so many group of other volunteers are there, and some of the institute, they have shown very good models related to involvement of volunteer in eye care. They can be the Anganwadi workers, the school teachers, the community volunteers, panchayat leaders, NGO workers, health workers, and even the RMPs, general practitioners, they can be helpful as primary eye care force. It is the right time that all these people, they should be involved into primary eye. And the most important aspect, and even the government of India is also very clear, as far as COVID is concerned, what we need is strengthening our tele-ophthalmology services. The specific guidelines are there for telemedicine, teleconsultation. I hope that these guidelines should be followed by all the practitioners. The tele-ophthalmology, it is being promoted now. Till now, Dr. Murthy mentioned that hardly 1% people, they use tele-ophthalmology, but probably it is right time that we have to go ahead. Beside ROP and DR, it is essential that tele-ophthalmology this facility should be developed in vision centers. Through vision centers and ophthalmologists, they are sitting at the base hospital, and actually they are providing guidance to optometrists and patients through tele-ophthalmology. This is the future, and we need best model for tele-ophthalmology, simplest model for tele-ophthalmology. You can use WhatsApp, you can use simple method, so that services should be available to the patients. And of course, the electronic medical records, that should be taken care of, that they are best if we are using tele-ophthalmology. And yesterday, Dr. Umang also mentioned about this thing. What we need, that this should be taken care of. What I personally feel is that it is the COVID-19 is going to stay for some time. We are 80,000. As the AIIMS letter mentioned, that peak may observe in June or July. So number can increase to any extent, but probably what we need is, we need to learn to live with COVID. We need to know what is new normal in our country. So new normal, as for everyone is concerned, is that maintaining social distance, a distance of ideally 2 meters or at least 1 meter distance, hand washing with soaps and use of sanitizers. Probably you can see that everyone using mask, use of disinfectant sprays, some travel restrictions, and avoid social gathering. This is the new normal for everyone. And as far as the eye care is concerned, the new normal is the instruments, and then is essential. Need for tele-ophthalmology and patient education through telehealth. And this is the new normal in healthcare. If we adopt these things, whatever the COVID is, probably what I feel is that we will be able to achieve what we want to, that is the normal eye care services in our country. Thank you very much. Thank you.
So, sir, Miss Uma has asked, how can we calculate the unilateral and bilateral cataract, especially for people above 50 years of age?
Yeah, Uma, actually there are certain methods, and certain this Excel based apps are there which are being used. In fact, people we have given these numbers to Government of India based on the prevalence of cataract, prevalence of unilateral, bilateral cataract. The prevalence is actually based on the surveys which we conduct, and based on that prevalence we apply those numbers to overall population. And in fact, certain apps are there, we are using those things, and we have submitted to Government of India about the numbers. Probably number which is required to eliminate cataract blindness is very high. In fact, I don't want to say figure right now, but the Government of India is currently looking forward towards around 75 lakh surgeries, and different institutes, different states, district, they have been given number accordingly. But definitely we have different methods, and it is not possible to give all the details here right now. Yes, next.
So
Neha.
Ms. Pooja is asking, will the pandemic affect funding for national programs?
This is something, one question which even at this stage, no one is aware. But yes, as I mentioned, quite expected that the national program may be affected. What we are expecting that they should increase, because the cost of surgery will increase. They should increase the amount, the reimbursement for cataract surgery. Probably at least that will not happen. If they're not reducing, they may not even increase actually. Currently this is the thought, but we are not very sure about the future actually. It all depends on the status of pandemic and all that. Next please.
So how many times can N95 masks be used after air drying in OPDs?
See, as per the guidelines which are being used in AIIMS, they said the set of 5 masks, and every fifth day you need to change the mask. And they said after 5 times, that after 20 days, you need to reuse the entire set. So, one mask after 4 days and 5 times. This is the norm which is being used in AIIMS right now. Next.
So next is a little, I mean, I don't know how much we can predict, but Miss Elizabeth wants to know if government, when is it that the government is likely to grant permissions for outreach camps?
Hi, Elizabeth. Yeah, in our discussion with the ministry team, they said it is at least 2 months. But this is very difficult. We are not sure about the status of the pandemic right now. If it is, the number will increase. I believe the chances are less. Yesterday, Umang was talking about it may not be permitted, say, around for 6 months. So we are not sure, but definitely it is very clear for next 2 months it may not be there at all. It may take 6 months, it may take 1 year, but for next 2-3 months probably it is difficult. Next, please.
So Dr. Jib is asking, is it possible to eliminate trachoma, particularly for from the underdeveloped and developing countries, where sanitation and hygiene remains a big challenge?
And Dr. Jib, in fact, I would like to clarify this thing as far as trachoma status in India is concerned. The trachoma in children has already been eliminated. The prevalence which we got is around 0.7%. And the WHO guidelines for elimination of trachoma in children is 5%. So it was eliminated way back, but we are proving it right now. As far as trichiasis is concerned, the guidelines are it should be uh, less than 2 per 1,000 cases above 15 years of age, and we are quite near to that number. And possibly, if we do survey at this stage, we can say that it is eliminated. The only issue is that the guidelines, the elimination do not mean it is zero. There is some specific number is there, and India is definitely very close to elimination at this stage. Next, please.
Sir, around Arogya Setu app,
Hmm.
if you have, I mean, if is the government also planning to make something around similar to an Arogya Setu to support the blind and visual low vision patients, since it is
See,
not accessible app as of now?
I'm not aware at this stage, but the way government has taken this issue, the Arogya Setu app, and probably people are working on this. And there are certain apps available for the blind and visually impaired patient. And I hope in near future it will be there because people are already working on it. But I am not sure what stage they are and when it will be started. Next, please.
So COVID-19 has of course impacted the eye care ecosystem, and Dr.
Dr. Jip,
Jibgan wants to
questions.
ask, yes, yes, yes. How do we manage the post-COVID-19
How do you
impact?
plan to manage the post COVID-19 impact, particularly in the eye care services? Probably this question is everyone is thinking about this question. How will we manage the impact or something? Probably the only thing is that we should start to normalize to go back to our services as early as possible. Most of the institutes they have started their eye care services, and in fact, even in AIIMS, we are sitting here at Apex Institute. Our eye care services, routine eye care services, will be started soon, maybe tomorrow itself. So, and I believe once we'll start our services, probably the impact will be taken care of. Next, please.
So given that the outreach cannot be conducted, given the guidelines, so how can surgeries be booked in NPCB program?
As I mentioned in my lecture also, it is not necessary that if you're booking surgeries under NPCP program, they have to be camps. In fact, Government of India permits surgeries through vision centers also. If you're saying that you have a fixed facility vision centers and the patient have been booked through vision centers, definitely you will be given funds. Even if patient is coming for free surgery directly to your base hospital, yes, it can be booked and NPCB will provide funds. In fact, this was cleared by so this was cleared by Dr. in one of the session. So be clear, it is not, camps are not essential. Surgeries done for free surgeries through routine patient, OPD patients, or through vision centers, they are permitted for reimbursement. Next, please.
So are there any particular norms for transportation between, from a base hospital to vision centers? Or they're known, I
See,
mean,
the
is it,
norms for traveling, so transportation are very clear that you need to maintain the guidelines related to social distancing. The rest is same. In green areas, it is already permissible. In red zones, probably in few days, we are expecting that these things will be allowed. But just accept the social distancing norms and wearing masks. These are the common, I said the new normal that need to be maintained. Next, please.
so particularly for the field level health workers, what kind of preventive measures you think they should take, like a 3-ply mask, cotton mask, gloves, and a cap is enough, or more is required?
I believe for field level, they are taken as part of the low risk with a 3-ply mask and gloves. These two things are sufficient for them at this stage. These as per the guidelines. Next, please.
So is there any research initiated by the RP Center in Ophthalmology and COVID-19? Research.
Actually, yeah, some proposal have been submitted to our research section, and especially proposal have been submitted to conjunctivitis, prevalence of conjunctivitis among COVID patients. That is being taken care. That's one proposal which is now been submitted and approved. And there's few studies related to impact of COVID-19 on their routine services as well as on their healthcare and especially psychological aspects that has been taken care. Nearly 3,000 different projects have been submitted to research section in all the fields. I'm not aware of all those things, but definitely conjunctivitis and COVID that has been taken care. That I'm aware. I know. Next, please.
So given that the mobility is a challenge as of now, so mobile vision centers, do they make better sense at this particular scenario compared to
See, in
static
fact,
vision centers?
who has asked this question? This is
Mr.
Prashant.
Prashant.
Huh? So Prashant, in fact, I also had the similar opinion that we should start mobile vision centers that should be permitted. And you are very clear because of the mobility issues. But what the group felt is that it is very difficult. Mobile vision centers have been assumed as eye camp only. That they are actually being used for the patients or the team members, and ultimately a camp is being organized. So the issues related to social distancing are difficult. In fact, what we want to divide that one mobile vision centers which has been routinely providing services as vision center only. And if you can fix number of patients, say 20 patients in that vision centers per day, that can be a process or something. We hope that ministry will come out guidelines related to the mobile vision centers very soon, and they will also permit mobile vision centers. This is the need of the hour, and we feel that it should be initiated at the earliest. Next, please.
So a clarification, can outreach programs be organized in green zones?
Again, as I mentioned in my presentation, even in green zones, outreach program means we are talking about eye camps. Even in green zones, they are not permitted right at this stage. Next, please.
So all hospitals are in preparation of making modifications for preparing to start OPDs and cataract surgeries. It's going to be a huge investment for NGO and trust hospitals. And then with reduced surgeries, it's going to affect them badly. So how government is going to help them, or are there any government plans that you think you're aware of and you would like to share, that how the government will help these NGOs or trust hospitals?
In fact, this is the key concern, not only for eye hospitals. In fact, eye hospitals comes very back in number. Actually, there are other issues beyond health also, which are important for country. In fact, what I personally feel is that government of India is currently not thinking everything about all these aspects. They are more into major areas of actually not only healthcare but other areas. And as far as healthcare, it is the COVID related issues which are more important. But very soon, say in 1 or 2 months, when things will settle down as part of COVID, probably I personally feel now healthcare, eye care will be given importance in future, say after 2 3 months. And we are trying our level best through RP Center. Chief RP Center is basically advisor to Government of India for national program. And we are working in this direction that some package, something should be started for the people, for the NGO workers who are actually providing services. 60% of the cataract surgeries are being provided through NGOs and just 40% by the government sector. And it is essential right now that we should think about those NGOs, and more package, a good package should be arranged. But at this stage, what I feel the easiest thing is that providing more fund for cataract surgery, and that is feasible in Ayushman Bharat. In Ayushman Bharat, we're providing amount up to 7,000 rupees, whereas NPCB it is just 2,000 rupees. So if we get more amount for cataract surgery through Ayushman Bharat, probably this is one of the area where we can think of covering of some of the aspects. Let's hope for the best. Next, please.
So there are a few questions around asymptomatic COVID patients. How do we deal with them? Either them interacting with the staff and then you have to deal with the staff, or the vision centers.
See, if asymptomatic COVID patient is there, that means asymptomatic, but he is identified positive in sample. For those patients, as far as government guidelines are concerned, they are very clear that such patient should be like they can be uh, sent for home isolation. And in case their contacts are there, they should be screened for COVID test after 5 days of contact, minimum 5 to 15 days of contact. They should be actually tested once, and if they are found positive, then again the measures of isolation and quarantine should be adopted. So it is very clear. That's the key reason that everyone is tense. In case they find any patient which are asymptomatic and found positive, what will happen to their services? Their staff will come in contact with such patient. They need to be quarantined. They need to be isolated if they find positive. So that is the panic, and everyone is worried about these things. But currently, these are the guidelines, quarantine, isolation, and let's see how these guidelines changes in future. We are not very sure about this, and there is no solution for this for these things at this stage. Next, please.
So what do you think are the areas of innovation post-COVID in ophthalmology particularly?
So I'm very clear. One clear-cut area is basically use of tele-ophthalmology, telehealth network for training programs, etc. That is one area which is very important. For refractive error, Dr. Omang Mathur, he yesterday mentioned that there will be some other methods can be started for tele screening of children for visual impairment or refractive error or something. And probably that is one area. And so this is one common area, and strengthening primary eye care, that is the key for future actually. And all the agencies who are like the equipment, they are manufacturing equipment, they are coming out with the new type of equipment which have their automatic shields, etc. This is also a small innovation, and automatically people will, they don't need to use other PPEs, and that even though shield will prevent people from COVID or something. This is something small innovations. Let's see what new we'll get. I'm not very clear about at this stage, but hoping for some more for more research and innovations in this area. Next, please.
So are there any particular guidelines for running vision centers at this time?
See, as far as guidelines for vision center are concerned, only thing is these AIOS guidelines which have been prepared so far, and as I mentioned, chapter 16 of those guidelines that cover the vision center component, and in fact, it has mentioned in details what precautions to be taken when patient is there, what PP is to be used, and while doing refraction, etc., what precautions should be taken. So these are the guidelines which are currently available with us. In fact, those guidelines are being submitted to Government of India in its plan, and hopefully Government of India will provide additional guidelines along with these one very soon. But at present, officially through Government of India, we don't have guidelines. AIOS has given their guidelines. Next, please.
So, what could be done in states where cataract surgeries are not covered under Ayushman Bharat schemes? If MPCB budget reduced to, what will be the options then for the NGOs?
See, NPCB budget reduced. It is already low actually. 2,000 rupees is very low for cataract surgery. What I find, and I don't think they'll reduce beyond this one. This is very clear. Below 2,000, it will not be there. But even 2,000 is very low. And what we are expecting at this stage is that, in fact, I am very clear. We try our best. All the people who are working in eye care, that state which we have that are not covering a cataract as part of Ayushman Bharat, they should also cover Ayushman, this cataract surgery as part of Ayushman Bharat. Not only cataract surgeries. Currently, 40 procedures have been involved as far as eye care is concerned. We are expecting that these procedures should increase to nearly 60 to 70 procedures. And in fact, I hope that such kind of like initiative will be taken and advocacy will be done in this regard very soon. Next, please.
Sir, given the COVID and again, given the financial stress that hospitals are facing, immediately after the lockdown, there'll be a lot of like paid services. Hospitals would rather prefer patients who can bear the cost of surgeries. So what happens
Right.
to the ones who are marginalized, and will government take any initiative in this regard?
See, such kind of initiative is very broad initiatives. It is not only in eye care. That will be in all type of healthcare. So private institutes probably what we are thinking is that currently a patient with fever for 1 or 2 day fever, they are not usually admitted. But now they will be admitted and huge costs may be charged with huge amount. And probably whatever guidelines will be there, there will be comprehensive guidelines through healthcare. But at this stage, the government is probably not thinking about those. The current status is very clear. It is the COVID, and beyond COVID, definitely the way at this stage government of India is bringing out guidelines. You know, every day you get 1 or 2 new guidelines, and I'm sure they're so active at this stage, and very soon such guidelines will be there related to cost restriction or something as far as healthcare is concerned by private or other partners. Next, please.
So what will be the scope of an optometrist for the optometrists in the country post COVID-19?
See, I personally believe there will not be any change. It will be totally normal after a few months, and, scope will remain as it is, what is there. In fact, when we are talking about strengthening primary eye care services, strengthening vision centers, and if such initiative be taken at a high level, probably government is very clear. In fact, as for national health policy, which came in 2017, it was very clear that more and more funds should be given to primary health care, and primary eye care is component of primary health care. And now if we think of strengthening our primary eye care through vision centers, so we are very clear as far as optometrists are concerned, more and more optometrists should be appointed, should be part of the system as far as eye care is concerned, if they like to go to vision centers. Another issue in our country is that the optometrists who are well trained, they avoid going to remote areas and vision centers. That need to be taken care of. But I personally feel, as far as optometry branch is concerned, they should feel that it is an opportunity for them, that COVID will bring out something more from them, and more opportunities will be there for optometrists in our country. Next, please.
So should refractive services resume with proper precautions?
You're talking about refractive refractions. Definitely,
Ref-
as I mentioned, with the precautions. In fact, when we are thinking of surgeries and everything, then refraction should be resumed as early as feasible. Just take specific precautions, and those precautions are very well given in AIOS guidelines, even in community of the vision center guidelines given in AIOS guidelines. So please follow those guidelines and start doing refractive. In fact, what maybe there, then initially you'll be doing less number of refractions, and slowly that number will come to the norm. But of course, all the guidelines related to social distancing, mask, etc., those need to be followed. In fact, careful cleaning of your equipments, that is also very essentially required, and all those things are given in great details in those guidelines. Next, please. Where is Anu? I can't see Anu actually in the
It is
faces.
way down. So she's saying that the deaths around for the people who have been infected with COVID-19 is more with the elders, with the people who are more than 45 years, 60 years. So
Mm-hmm.
should we have an eye care strategy particularly for them, for that age group?
See, the death is it's not 45 actually. It is beyond 60 year of age. In fact, when we are looking at this Indian data, it is beyond 70 year of age is more deaths are there. Um, uh, as far as this world report on vision is concerned, I don't think there will be a separate guidelines related to these things. But definitely, as I mentioned, this is very important that people will. It's not the service provider. It is basically the demands will be less because people will be having some kind of fear and risk that if they go to hospital, they may be infected with COVID virus something. So there we need to start some kind of system of counseling of such group of patients, in fact system, so that they should overcome their fear, their tension, and should come for surgery. But for as far as world vision report is concerned, I don't think that they will not come out with this any issue or something.
So
Next, please.
given the fact that
Mhm.
vision centers play a critical role at this time and anyways and like beyond also, is government of India giving any help, support in deployment of vision centers, particularly now?
See, as per the current strategy, they are already giving help of 1 lakh rupees for starting vision center in remote area. 1 lakh rupees. In fact, I personally feel there should be major strategies that NGOs, they should be permitted to work in primary health centers which are being managed under government of India under district programs, so that infrastructure issues should be taken care by the government, and the human resource and training component and service delivery component will be taken care by the NGOs. Such kind of policy is required in our country, and that is the actually a PPP model which we should look for in our country. Otherwise, it will remain like this. We every 5 year in national program we are looking forward for 5,000 vision centers, and the number of vision centers were not increasing. Even at this stage, by the year 2020, we wanted 20,000 vision centers, and we just have hardly 4,000 vision centers. So until and unless we'll not involve NGOs to provide primary eye care in government facilities, this issue will not be resolved. It is the need of the hour at this stage. Next, please.
So although Dr. Mathur had asked this question very well, I mean, he had described it very well
Answered this
yesterday,
question.
but I'll just, since this question has again come up, for the low vision patients, mobility is critical, and anyways, it's critical, and given this COVID social distancing, it is a bigger challenge. So what is your take on this?
See, it is definitely a major challenge. In fact, Dr. gave a full lecture on this thing, that how to take care of such patients who are having who are visually impaired, and the issue which was discussed, can we develop some kind of apps in their mobiles. In fact, I discussed this thing with one of my partners working in low vision. In fact, yes, such apps are available and they can be downloaded, and they can measure a distance of say up to 1 meter, a kind of vibration can be there in their mobile phones with this thing. So such kind of things are coming up, but people are not aware of these things. I believe that COVID will help them to know all these things, the apps and such kind of apps, and probably more and more people will use such apps now. And of course, lot of initiatives are required at the government level also for such patients. Uh, uh, let's hope so that something will be done, but it is one of the major challenge at this stage. And I believe our people who are visually impaired or blind at this stage, they are suffering a lot, and we need to act immediately in this aspect. Next, please.
So, sir, for the IAC, will there be any special IAC activities or material in the coming days in the field of community ophthalmology, keeping in view the COVID situation? All the government
You
has, I
know,
think, given certain,
yeah,
yeah.
not about community ophthalmology, but as well as COVID is concerned, I was just looking after what IEC strategy has been adopted. In fact, you'll surprised to know that training have been arranged for most of the field workers, community level workers, volunteers, ASHA workers, in relation to training of these people in COVID, and that is through telehealth system. And it is opportunity for us to using the same model, same system for our community ophthalmology programs. And very soon, in fact, I'm very clear, we will be showing such kind of models very soon for our people, our volunteers who are working community, and such models can be used by other centers also. So now we have learned through COVID, so this is something positive, that yes, this is feasible, and we'll try such exercise in our areas, right? Next, please.
Can we use N95 mask for a longer period by decontamination under UV light?
See, I'm not very clear about this answer because as far as UV light decontamination is concerned, there are some specific guidelines about time of exposure or something. Uh, I'm not very sure about the response for this thing.
Next is again, sir, around school screening. Yeah, obviously, again, the schools are shut, but what is your take on the school screening eye programs post lockdown?
See, as far as school eye screening is concerned, this is one area which is very important. And what I feel is that people are talking a lot the new guidelines or something. School is that area which will be open only when we have some kind of like this COVID pandemics will be like restricted or it will come down. Beside that point, probably schools will not be open. And after that, my personal opinion is that if we follow the standard guidelines, the social distancing and care of mass, everything, I believe school vision screening program can be adopted. Only thing is that such measures need to be taken care. Some of the people are thinking that we should have a newer guidelines for school vision screening or something. Probably if we these universal procedures, if they can be included on those guidelines, I believe even the teachers can be used for primary screening. There should not be much problem. But let's see how things happen. I don't think there should be a separate guidelines for this thing. This should be taken into normal things very soon, very clearly. As soon as school will open, probably will be providing routine services. This is my say at this stage. Of course, we can think of some methods, some newer techniques, but probably that will come slowly as per routine, not because of pandemic that we need to take something extra. I'm very clear the school vision will be a normal practice once school will open. Otherwise, if some issues will be there, government probably will not open school itself. Next, please.
So, mobile cataract surgical programs, has it been stopped as of now, or and if so, then when will it be started again?
What do you mean by mobile surgical? That means surgery in mobile vans. Probably
Yeah, I think that.
it was stopped in 2001. In fact, in one or two states, they were doing this thing, but that is not officially allowed as per NPCB is concerned. So we are not permitting any surgeries in mobile camps or something that was practiced before 2001. Now it is expected that we should use reach-in approach, where you can conduct screening and vision centers. Now, instead of camps, I'm saying it is vision centers. Patient can be brought to base hospital in green zones. Of course, in red zones, we have to wait till the routine transport services will start. And then surgery should be done at the base hospital only. This is the norm at this stage. And I don't think that mobile surgeries, the surgical camps will be allowed. Next, please.
So, a lot of hospitals are producing sort of in-house PPEs, or of course, some all others are procuring PPEs. Are there any guidelines that they can refer to either while producing or procuring the PPEs?
Government of India has list of nearly, say initially it was list of nearly 100 PP providers, probably more and more and coming. Probably that list should be there everywhere in all the districts now, and there need no need for a national level guidelines for these things. Probably the district level authorities will be having exact number, details of these people. Initially there was an issue, but now Government of India is already preparing more than say 2 lakh PPs per day. So now there's not an issue of providing PPs or something. That's freely available. Next, please.
So in terms of trainings and fellowships program, of course, online trainings and all are always possible. But let's say internship for optometry students or ophthalmologists, fellowships in OPDs, are there any guidelines, and what is your take on it?
So far, there are no such guidelines, but even in exams where our doctors are being tested, now we are using online system for their examinations, MS ophthalmology people. So probably more and more things will be online now. And of course, when let's see how it will resolve. Refraction is one thing which we need to train in patients, and probably it will be resolved soon, but at present there are no such guidelines also. Next, please.
So for the home, what's your take on the home services for patients follow-up, check on, it can reduce the cost, etc. So home services for patients follow-up, particularly maybe in the green zones and the orange zones.
Home services means
So
what
for
do
the
you mean?
follow-ups, I think so. After emergency, let's say surgery, if a patient has to follow up, and if it happens to be a green zone, home services for follow-up, does it make a better choice, or
I could not understand home services. We recommend teleconsultation services.
teleconsultation? Right.
Teleconsultation is definitely it is there. I don't know. Home is the doctor going to the patient's home. That
I know.
probably is not feasible.
Correct. Okay.
It is basically teleconsultation services, and it is being adopted everywhere now. Even in AIIMS, we have started teleconsultation, free teleconsultation for the patients. Our residents are doing it right now in our system. Next, please.
So what type of social marketing is necessary? Okay, so what kind of awareness drives can we do with the patients around COVID-19 to change their
Awareness.
behavior?
Yes, I think every day, everywhere, we are listening the same things. It is basically social distancing, use of mask, travel guidelines. All these are the common things right now, and probably everywhere aware. Uh, and the best part is that such kind of behavior has been changed now. When I see people around me, everyone is wearing masks. People are concerned about social distancing. People are using disinfectants everywhere. So I think, of course, in remote rural areas also, our teams, our volunteers, our ASHA workers are now being involved into such kind of training programs, and specific guidelines have been issued for this thing. But these things are minor things, difficult to adopt. But the best part is that people are adopting all these things. Otherwise, it was so difficult for us to wear masks full day in office, but we are practicing it right now. Next, please.
Sir, is there any advisory or plan of the government? There's to cover the larger. I'll just read it out. I'm trying to make sense of it. Is there any
Who is the person?
advisory? Gohar's question.
Mhm. Plan for government how they would cover the large pendency of urgent cataract surgeries during or after COVID. Gohar, something difficult to answer at this stage. It is not that if we have providers, they will provide surgeries. It is the demand which is also restricted. I have a very strong doubt that patient will come for cataract surgery. It will be very difficult to counsel patient now. Uh, yes, government need to take certain action so that we should achieve our targets of eliminating cataract blindness. But at this stage, I am also not very clear whether we will have such guidelines or not. In fact, very clearly when we ask by National Program for Control of Blindness about guidelines for cataract surgeries, they're very clear at this stage. They are not issuing any guidelines. The guidelines which are being issued for other surgeries, they need to be followed. But definitely, we'll have meeting very soon. In fact, there is a committee related to this thing under Government of India, and also I'm one of the member. And we'll decide something special how we can achieve cataract surgery. That the target for cataract surgery is for the year. That will come out. But at this stage, I don't have a very clear-cut solution because of the status of pandemic at this stage in our country. Next, please.
So for the standalone or integrated vision centers, how can the quality be monitored?
Whether it is for integrated or standalone or both.
Both.
Hello.
So
What we
both.
recommend, the optometrist training is the key component, and government has given guidelines. The minimum 2-year trained optometrist should be there in vision centers. This is one. As far as integrated vision centers are there, we are expecting the medical officer in charge who's there in the center. He will take care of the most of the quality issues. For standalone vision center, it is expected that the ophthalmologist should visit once in a week or maybe less, but they should visit and monitor the services there. These are the standard guidelines. In fact, they are monitoring procedures, daily checking of the patient's data, patient's uh, diagnosis, what the optometrists have made. Those things can be checked on routine basis, actually on daily basis in the afternoon when optometrists they come out. But of course, the training part, training and actually supervision, these are the two things which need to be taken care of at all aspects. And it is very much feasible. We have tried. We are running 28 vision center right now, and it is very much possible to monitor these vision centers. There is not much difference between pre-COVID and post-COVID in this area. Next, please.
Sir, this is the last question.
Bharat, yes, the direction has been sent to the SPOs and the district program officers as far as the starting of services are being concerned. As far as vision center reimbursement is concerned, probably you are not part of that meeting when we had meeting with Pramila Gupta, and it is very clear. She herself mentioned that vision center patient will be allowed for reimbursement. And of course, we will request her again that even such direction should be sent to all SPOs and DPMs so that they can follow these guidelines which are being thought at the national level by the policy makers. Thank you. Thank you.
Thank you so much, sir. This was more than 50 questions that Dr.
Okay,
Vashist
but
has
I was not very
answered and very
comfortable.
candid. Oh,
It
I'm so
was
sorry, sir.
I'm sorry, I was not comfortable in answering many questions
Oh,
because
that's
the reason
okay.
is very clear. No one is very clear about what will happen, but I could answer as far as my knowledge is concerned. But the best part is I really thank Orbis and Cyber Site that they have taken such good initiative. I don't know about others, but this set of 5 lectures, they have helped me a lot. I have listened to all 5 lectures, and probably the lectures covered by Dr. Shamanna, Mr. Tulsi Raj, Dr. GVS Murthy, and especially Dr. Omam. They are extremely informative, very clear cut. This is probably one of the best efforts that have been taken by NGO at this COVID era, and we hope that similar initiative will be taken in future. Thank you very much. It was really nice. I thank everyone for giving me opportunity to be part of this program. Thank you very much. Thank you, Nayan. Thank you.
Thank you so much, sir. Thank you, everyone, for your active participation. And we sincerely hope that you found all the discussions very informative and thought-provoking. Thank you so much. Please take care, stay safe, and continue unlocking possibilities.